Good morning. I am Sreelekha, working in the field of cancer nursing. I am expressing my views and experiences with regard to mental health of nurses in the field. Working with patients suffering from cancer is really an analogy to being on the front line of war against hopelessness, disfigurement, and suffering. It involves handling frequent unexpected crises, both physiologic and psychological. Long term continuous contact with such patients, heavy workload, often combined with suffering, staffing issues, high risk work environment with chemotherapy and radiation therapy, dealing with ethical dilemmas. The stress that comes from caring cancer patient is too much because nurses care such patients so deeply that they can find themselves empathetically experiencing similar emotions of the patient who is going through the continuum of the disease like cancer. They also experience compassion fatigue. During the past few months, the challenges which are brought by the COVID 19 pandemic, providing care in difficult circumstances, going to work fearful of bringing COVID 19 with them, all increased the work stress of nurses. So, caring for mental health of nurses are important. If not appropriately cared, it may affect the quality of the patient care that deliver and can cause absenteeism, resentment, experience of negativism, use of poor judgment in care, and causing repeated error. So, we do care for providing a more positive work environment for our nurses. In our privileging process itself, nurse managers are given skill training in listening skills and creative supervision so that nurses can open up to them. We do help them balancing work and family life. Nurses with elderly parents, feeding child, those who are experiencing less support from family, especially from spouse and in-laws, all we will add to the stress of the patient and affect stress of the nurses and will affect the mental health. So we pick such nurses and provide less duties with less frequent nights, stress shift. When feeding mothers are given night duty exemptions till 1 year of the child. Our rosters are planned in such a way that less interruption to nurses' work. Calling nurses for emergency work shifts are maintained to a very low rate. So those nurses at home can say centered in their life. They can be truly with self, family, and significant others. Our institution has formed a grievance redressal committee. Unresolved issues can be brought to there for constructive solution. Opportunities are also provided to nurses so that they feel worthy through appreciation, awards, and challenging assignments. They are also given extended roles of performance other than routine nursing care, which give them self fulfillment in work. During night duty hours, all the nurses are given 2 hours relaxation from their routine care so that they can return to work with extra vigor and positiveness. Our future plan is to combine a wellness program for nurses, which is a blend of goodness of yoga and relaxation. I also appeal to the public that they behave more supportive to nurses during crisis situation. They have to stop blaming them. We are also planning to utilize the largest resource remaining unutilized, that is the carers or the public. They need to be supplemented with adequate caring skill so they can act as a support system for nurses, which will eventually reduce the stress of the nurse and can improve their mental health. Thank you.